Hi, my name's Heather. I'm a nurse at U of R Home Infusion Pharmacy, and I'm going to show you how to do an IV push antibiotic using a PICC line. Methods are the same if you have a PICC line or a Mediport or a tunnel line, so the process is always the same. Medications are in a syringe and they go in the refrigerator for storage. You're going to bring this out of the refrigerator about 20 minutes before your infusion, just to bring it to room temperature. It is more comfortable for you. You'll have an instruction sheet that tells you step by step of how to do everything. At the top it tells you what supplies to gather for each of your infusions. So laid out for you is the exact way you want to do your sequence. We're going to use alcohol in between every disconnect, and saline first, antibiotic, saline, and then heparin is last. So after you remove your medication from the refrigerator, you're just going to make sure that the label has the correct information on it, name and date of birth. You're going to wash your hands with soap and water. Hand sanitizer is fine as well. And you want your area clean, so wipe that down before you put your medications on it. So the first thing we're going to do is take things out of wrappers so that you're all ready for them. Okay, I've already cleaned my hands. I'm going to go ahead and remove the cap that goes on the end. It's a twist. And then I'm going to clean it with alcohol for 15 seconds. Nice hard scrub. And then I'm going to let it dry in between for 15 seconds. In the meantime, I'm going to take the cap off of the saline. I'm going to pull down to move that plunger because sometimes they're stuck in there. So we're going to pull down, and then we're going to push the air out of there. This is a push and twist. And I'm going to open up the clamp. So what you want to do is a nice hard push pause. So push, stop, push, stop. And you're going to do that until it's all in there. And then I'm going to remove that. I'm going to clean again with another alcohol pad. And then you let that dry for 15 seconds as well. You're going to take the top off your antibiotic. There usually isn't any air in these, so we're just going to go ahead and attach, push and twist. So the top part of the plunger is generally at the 20, depending on the dose that you're getting. So your starting point is going to be where that top line on the plunger is. So right now mine's at the 20. We're going to push 2 dashes and then we're going to stop. And then I'm going to wait a full minute in between. And you're going to do this until it's all in there. Generally, it'll take you about 10 minutes, doing 2 lines and wait 1 minute. And for teaching purposes, I'm just going faster than the 1 minute. All right, so that would be 10 minutes, or 2 lines, wait 1 minute. I'm going to clean again with another alcohol pad. I'm going to flush with the next saline. Pulling down first, and then pushing that air out, and push and twist. A nice hard push stop. And clean again. And last is the heparin, if it's ordered for you. We'll do the same thing. We're going to pull down and push that air out. So the main job of the heparin is trying to prevent any clotting. So that's your very last step. So what you're going to do is you're going to push slowly in. And then when you get to the last push, we're going to clamp to lock that in there. All right, we're going to take that off of there. And put a cap on the end. And just a twist on. So if you have the one with the 2 lines, they both need to be flushed daily. So you do the antibiotic in one, and if you're only doing it once a day, you're going to flush this other line with a saline and a heparin and put another cap on it. And that's it.